Hello again, my friends. I'm Dr. Cooper with Balanced Chiropractic. I'm so elated for the opportunity to speak to you today. Hey, we miss your faces. We miss your smiles. So please leave some smiles in the comment section. We look forward to seeing it and addressing your needs in the community here. Today, I'm going to give you 5 questions. Okay, we're going to answer 5 questions common to those going to see a chiropractor. So 5 questions, we're going to cover that today. The number 1 question is going to be, why not drugs? Okay. The number 2 question is going to be, what if it goes away on its own? The number 3 question is going to be, how often should I go for care? The number 4 question is going to be, does insurance cover? And then the number 5 question, the biggest question of them all, is, does it hurt? Okay, so we're going to dig in right here. 5 questions commonly asked by those going to see a chiropractor. Okay, so here it is. Number 1, why not drugs? Dr. Cooper, I've been dealing with this for a long time. I'm quite sure that drugs have helped me manage my discomforts, my headaches, my low back pain, and I've done just fine just using drugs. And I'll submit to you, my friends, that it's excellent that you have some sort of mechanism to help you maintain your discomforts. But I would also say to be very careful, because we use drugs to manage our discomforts and our pains. Oftentimes, it's just like turning your check engine light off in your vehicle. Okay, so you have a yellow or a red light that will show up as an indicator that there's something going on in your vehicle or your body. And oftentimes, once you shut that light off, you shut off your opportunity to really figure out what's going on. So just because you shut off that light, my friends, does not mean that you won't end up on the side of the highway. It also doesn't mean that you won't have some sort of expensive procedure to make sure that you can jumpstart or restart your engine in the future. So I would like to encourage you with the fact that, yes, it's great that you have a mechanism, but also be very careful in that process, because that's typically when we allow things to take hold of our bodies and really begin to damage our bodies as our primary vehicle. Number 2, we're going to jump right into it. What if it goes away on its own? Okay, excellent question. Oftentimes, I notice that our pains, they revolve on a cycle, okay, on a cyclical pattern. Some of us will go so far as knowing when our pain is going to occur, even before it occurs, be it weather, be it certain social stresses, like family dealings, family health. Also, some of us will notice that our pain is typically tethered to our workloads, sometimes other things and activities like around the house work, okay, which is just simply the case for most people. Okay, pain does revolve on a cyclical pattern, which means there's something going on. Going on that's ultimately affecting you and keeping you in the cycle. Okay. Oftentimes when you go to see a chiropractic physician, our primary purpose is to figure out what's causing your cyclical pattern and to get you out of that cycle. Okay. So we want to get you in a place where your body can begin to heal, as opposed to the check engine turns on and then it turns off and then turns back on. So I'll submit to you that that's our primary purpose here, is really to help you elevate out of that pattern that you're in. Okay. Number 3, here it is. How often should I go? Age-old question. You'll talk to many people and they'll tell you completely different things depending on who you're talking to, depending on who they're going to. Ultimately, when you go to a chiropractic physician, our primary goal is to put you into one of 2 categories. Are you in a wellness phase? Are you in a maintenance phase? Are you in a phase of corrective care where we need to actually make some serious corrections in your spine? Okay, so there's a great chance that when you initially see a chiropractor, we're going to put you on a corrective phase, meaning to correct the things that we're seeing. This is our phase where we get you off the cliff. Okay, when we see you on a wellness basis, typically recommended somewhere after a corrective phase, our primary purpose is to maintain what we've done. It's to maintain our corrections. Okay, which is very important when we look at these social economic stresses. When we look at the cyclical stresses, the barometric pressures, the weather changes, everything can affect your ability to remain well. And so that's our primary purpose, is to get you in a wellness state. We're going to jump right in here to question number 4. Does insurance cover? Okay, very common question. You'll find that the majority of majority insurance providers actually cover chiropractic care. Okay, one way that you can check, you can always call your actual provider, your individual primary care. You can call your chiropractor, you can call your insurance policy and ask them, hey, what is my coverage to see a specialist? What is my coverage to see a chiropractor? So this is very, very important. And you'll find that a lot of times you have excellent benefits to handle your specialty care and your chiropractic care. Okay. Question number 5, here it is. Does it hurt? Okay, here it is, my friends. I will submit to you that it does not have to. Okay, there are many, many, many different techniques that chiropractors use a plethora of different ways to adjust your body and to adjust your spine and to work with you. Okay, one of the very reasons that we can treat kids, from babies, from actual neonatals, all the way up to the geriatric population in our older patients. Okay, which means that there probably is a perfect glove to fit you somewhere in between there. Okay, so I'm sure that there is a technique that your chiropractor could use in order to address your discomforts and to keep you in a comfortable position. Okay, so there it was, folks. 5 different questions for those going to see a chiropractor. These are very important questions. So I want to share it with you here today. And lastly, I don't want to end this without giving you an opportunity to get an assessment with us. Okay, we are here to help you meet your health goals. It will be our absolute pleasure and honor for you to drop a message down below in the comment section. And hopefully we'll be able to help you in your process back to health. Okay, so I'm Dr. Cooper with Balance Chiropractic. We hope to speak with you soon.